When I do a stem cell procedure on someone, I said, look, I'm planting a garden today. So what do you have in a garden? You have soil, you have seeds, and you have fertilizer. I'm an old Italian gardener. What can I say? But anyway, the fat is a scaffold. It basically is the soil. Now, where do my seeds come from? And it's not just stem cells, it's a whole host of regenerative cells, including stem cells. Come from the fat, believe it or not, but it also comes from the bone marrow aspirate, which is the liquid inside the bone. And last but not least, I get my fertilizer, which are my platelets and other factors. And that's basically how we do things. We plant a garden and watch it grow. And that's what we're attempting to do, reboot pathways, be it with stem cells, be it with hypoxia, be it with hyperbaric oxygen, be it with IV therapies. Well, basically for those kind of conditions, in the joints it'd be fine, and then we would give some intravenously at the same time. But
Oh, the
some things,
SVF. Mhm.
SVF. Well, this is
SVF.
SVF. SVF is a mixture of things. This is going to be more mesenchymal, but there'll be a little SVF in it, so to speak. But
I see.
realize that when you have immune modulators, one of the main things that MSCs do is they really quell that inflammatory response. Like I say, I liken them to Navy SEALs. They get put into a very tough area. They have a tough job to do. They're outnumbered, but typically because they're so efficient at what they do, they can get that area secure to let the rest of the forces go in and do the work.
Well, and talking about anti-aging, so I do know that you have some of the strategies that you advise people on how to maintain a youthful biological age. So I was wondering if you would be willing to share it with our listeners.
Cures, Remedies, and Beyond podcast with Dr. Irina, a Stanford-trained medical doctor, inventor, and a published author with over 30 years of clinical experience, is bringing together the science of medicine and the art of healing for ultimate vitality and health. It engages in discussions with healthcare providers, wellness experts, innovators, philosophers, spiritual and industry leaders, as well as health and wisdom seekers to provide you, the listeners, with practical tips and knowledge to help optimize your health and well-being. The Cures, Remedies, and Beyond podcast with Dr. Irina.
Welcome to the show. Today, we have the privilege of hosting a distinguished guest, an award-winning orthopedic surgeon, an innovator, a scientist, and a pioneer in the field of regenerative medicine and stem cell therapist, as well as an international speaker and teacher, and the humblest doctor I've ever met, Dr. Joseph Purita. Welcome to the show, Dr. Purita.
Well, thank you so much. It's an honor to be on your show. My Lord, what an introduction. Boy, thank you so much.
As the founder of the Regenerative Orthopedic Clinics, one in Boca Raton, Florida, and Pensum Regenerative Medicine Clinic in the Cayman Islands, you have been at the forefront of utilizing stem cells and PRP, or platelet-rich plasma, injections in sports medicine and various musculoskeletal conditions. Your clinics have become a go-to destinations for prominent professional athletes from the United States and around the world. But you also have love of treating the general population, like weekend warriors and people seeking to improve their overall health and functionality. In your clinics, you're also offering multiple methodologies and unique anti-aging treatments for those who are interested in comprehensive solutions for graceful aging while harnessing the power and the intelligence of our own bodies and our own cells. I really love one of your expressions: cells, not the doctors, heal the patients. You have consistently been several steps ahead of so many doctors, so many physicians, Dr. Purita. Your visions and your work have helped many of us, including myself, as I consider you to be one of my mentors, in transforming the field of non-surgical regenerative orthopedics and helping patients to heal and often avoid unnecessary surgeries and not rely on pharmaceuticals. So please tell us what makes your clinics and your approaches so unique, and what types of treatments do you use to expedite the healing process?
Well, that's a very interesting question. What makes us unique? Well, I think you said something that kind of resonates maybe to the audience. Cells, not doctors, heal patients. So I don't heal patients, but I can direct the cells to heal them. Now, I've been doing this for quite some time. And a number of years ago, I had an aha moment. I looked at basically a slide, and it was a slide of the stem cell aging pathways. And I said, if you realize, if you learn these pathways, it's going to make this whole field of anti-aging stem cells a heck of a lot easier. And it has been. When we start looking at the sirtuins, we start looking at the AMPK pathway. These are all pathways. I have an analogy that I like to give my patients and even physicians. Think of your body, your organs and your cells as the computer hardware, and these pathways are the computer software. Now, when we have a
Mhm.
problem with our computer, what's our first thing? We say, oh, let me just reboot it. Let me just shut it off and reboot the pathways. And that's what we're attempting to do, reboot pathways, be it with stem cells, be it with hypoxia, be it with hyperbaric oxygen, be it with IV therapies. And the other thing I've learned, most problems arise from defective mitochondria.
Right.
When all said and done, medicine comes down to a problem with the mitochondria. Aging, our mitochondria are failing us. And then when your mitochondria fails you, your immune system fails you. You get something called immunosenescence, which means in everyday lay terms, all of a sudden there's a lot of zombie cells in our immune system, making it not work as much as we'd like. And remember now, your immune system doesn't just protect you from basically viruses and bacteria. It protects you from a lot of bad things, cancers and neurodegenerative diseases, and on and on and on. So what we want to really try and accomplish is make it so we live longer, but we live well. We want to increase our health span. There's no point in living to 90 or 100 years old if you're frail and weeble and feeble and not enjoying life. So
Exactly.
that's sort of what I'm trying to do. I'm trying to basically, you know, manipulate these pathways. And when you learn about them, things really fall into place. We have a lot more to learn, but at least we've come a ways, so to speak.
Yeah, that is such a good analogy with the hardware and the software. So, and you did mention the sirtuins, so of course they're called the longevity genes, and there are certain mechanisms that, of course, can upregulate them or to stimulate them or downregulate them. So, and you just basically in a constant symphony how to approach the human body sounds like how to make it all very beautiful as a beautiful music. So I know you have been really pioneering new approaches, especially in your Cayman Islands clinic, so including the V-cells therapy. And I wanted you to enlighten us a little bit more on that particular type of treatment. What are the V-cells?
Certainly. So V cells mean very small embryonic-like stem cells. Now, there's a lot of different names for them. Some call them blastomeres, other people call them small blood stem cells. Now, when we say embryonic-like, they're nothing to do with embryos. They come from each and every one of us. But here's the interesting things about these cells. They're sort of an emergency stem cell supply. Now, these cells are what we call quiescent, meaning that they're basically asleep, as most stem cells are. Most stem cells don't really require much energy. They don't really expand much energy. They're kind of asleep, but they have to get signals to become awakened. Now, these cells, interestingly enough, become awakened through stress. And for instance, they're basically when the body undergoes a significant stress, let's say, God forbid, you're in an accident, you lose a lot of your blood supply. These cells would become activated. They're what we call pluripotent. What does that mean, pluripotent? It means that they can build many, many different types of organs and cells. Most of our stem cells are are multipotent, meaning they can go a couple of different lineages, but these mean they can do almost anything. So that's a very unique aspect of it right off the bat. Importantly also is they're your own cells. They're not cells from someone else. There's a concept out there that You can use umbilical cord stem cells, embryonic stem cells, etc. And you don't have to worry because these cells are what we call immune privileged. Well, they're not really immune privileged. They're what we call immune evasive. You can still have your immune system attack them. However,
Mm,
when we use your own cells, there's no problem with that. Your body recognizes them as being their own, and their body's not going to attack them. Another thing about these cells that's very intriguing is that they make something called telomerase. Telomerase is an enzyme that restores what we call the ends of the telomeres. Now, your DNA has little ends on it, and every time your cells reproduce, they lose a little snippet of DNA. They get smaller and smaller till
right.
they reach a certain critical length, and then the cell is typically programmed to die. Now, if your cells, the telomeres get longer, you're reversing aging. You're going back in time. That cell is getting younger. These cells make telomerase. So what does that tell us? It tells us that their DNA is fairly pristine. It's not really undergoing a lot of, shortening and things like that.
Mhm.
So another good thing. Now we have some proprietary ways of stimulating. I mean, I can tell you some of them. Interestingly enough, we use a compound called fucoidin. Now,
Mm,
fucoidin is an algae. It's typically found off the coast of Okinawa. And for some people that don't know it, Okinawa is considered one of the blue zones.
correct.
And we think probably it's one of the blue zones because by and large, a lot of the people from Okinawa eat a lot of this brown seaweed called fucoidin.
Oh,
And we
wow.
know that that has a very good aspect of stimulating our bone marrow to produce more of these cells and release them to circulation. But these cells have to be stimulated. And how do we stimulate them? We put them at a very cold temperature, 4 degrees centigrade. It's about 38, 39 degrees, and very low oxygen. We let them simmer like that overnight and then give them back intravenously the next day. Very safe. Now, we do have a little secret also. We mix them with something called a platelet lysate. What is that in everyday language? Well, we get the platelets, which are little growth factors, and we basically will pop them, so to speak. And what they do is they release all their growth factors, and we're giving those growth factors back intravenously.
And
Um,
those and those
Go
are
ahead.
the signaling, really, the signaling mini endocrine system that, of course,
Right.
lets all the stem
You
cells
know,
to understand.
when I do a stem cell procedure on someone, I said, "Look, I'm planting a garden today. What am I? So what do you have in a garden? You have soil, you have seeds, and you have fertilizer. I'm an old Italian gardener. What can I say?" But anyway, the fat is a scaffold. It basically is the soil. Now, where do my seeds come from? And it's not just stem cells, it's a whole host of regenerative cells, including stem cells. Come from the fat, believe it or not, but it also comes from the bone marrow aspirate, which is the liquid inside the bone. And last but not least, I get my fertilizer, which are my platelets and other factors. And that's basically how we do things. We plant a garden and watch it grow.
That's beautiful analogy. Yeah. So, I mean, of course, as a pioneer in this stem cell and regenerative non-surgical orthopedics, so you basically saying that you use all of the people own pretty much adult stem cells, but you utilize them in such a beautiful manner so that they potentiate each other, as well as, we're eliminating the risk of the, foreign type of tissue, so ejected in the patient. So, and including those V cells that basically you're saying that they're embryonic, but they're present in us as adults, correct?
Correct. So first of all, there's no ethical issues, and there's really no issues from the, regulatory agencies because we're taking them from the blood and giving them back to the blood. We're not manipulating them. So it's pretty,
Yeah.
pretty much a safe thing to do out there.
That is really interesting. So, and then what I understand you're using, one of the applications of your V cells was pretty remarkable actually for osteoporosis and osteopenia or demineralization
Right.
of the
You've been,
bone
you've
that,
been You've been doing your reading. Okay, so yes, we do. We've had some pretty good results with that. We've had some improvements on bone density. So it's not like, hey, the patient feels better. I mean, bone densities have shown improvement. And, you're lucky if you're using some of these biphosphonates, et cetera, if they show that same thing. We're learning now that osteoporosis is not just a disease of aging. We think it has some components of an autoimmune condition.
oh,
Um,
interesting.
it also seems to be helped by intravenous NAD because it helps with the sirtuin genes. Another aspect of osteoporosis, I'm just kind of was getting into this the other day. That one of the growth factors that we have, TGF beta, transforming growth factor beta. As we age, that accumulates in our plasma, especially. And that seems to cause fibrosis, which is kind of scarring, which is not something that's good for when you want the bones to heal. So we realize now that maybe if we can get rid of some of that TGF beta, that may help prevent some osteoporosis. And also, I started talking about pathways, which are all interrelated to each other. There's one pathway, AMPK pathway, which is a nutrient sensing pathway, one of the more important ones in the body, although they're all important. If you can stimulate that, it seems to possibly help keep the TGF beta levels down, and it very well may help reduce osteoporosis and a lot of other conditions of aging. And a very simple way of stimulating this pathway, among other things, is by diet, intermittent fasting, etc., and taking some AMPK stimulators like berberine, which is one of my favorites. It's over the counter. I mean, some people take metformin, some people have diabetes, take metformin, but there's a lot of people taking metformin for anti-aging and anti-cancer. So you can see now how these pathways really start, when you start understanding them, you can start putting the pieces of the puzzle together to make it work.
Wow, that is really remarkable. Yeah, and so simple seemingly and natural, which is what I love about
Exactly.
your approach. Yeah. So what is it that you do on the Cayman Islands as opposed to your clinic in Florida? So I know in the United States, unfortunately, we still have so many regulatory issues that I'm sure led you to the Caymans that still have,
Well,
pretty robust and rigorous procedure regulations, but, a little bit less restrictive.
Well, it's a little bit less restricted, but not by much. Caymans are very strict. I mean, you really have to, cross your T's and dot your I's down there also. But it's interesting. I'm leaving there tomorrow night for the weekend, and we're going to do some interesting cases. We're going to do some cell expansion. So what we've done is basically we've taken some fat from patients. Now, fat cells are very rich in what we call mesenchymal stem cells, which are a type of cell that is very prevalent in the body, and it can do many things. But one of the main things it does, among other things, it does something called immune modulation, where it basically gets the immune system to simmer down and not, cause a lot of inflammation in the body. So what we did is we sent this to a laboratory, and they took the mesenchymal stem cells out. Now they've expanded them in the laboratory. So we have dramatic numbers of them. And now we're going to give them back to the patients. We're going to inject some joints and give some back intravenously. Now, there are places in the United States that are doing that. I'm looking into doing it right now. It's still somewhat gray with some of the regulatory agencies. So I'm kind of, treading with caution, so to speak.
Right, right. And what type of conditions did you find that it's really useful? Like you injecting the joints for the osteoarthritis, I presume, right? So, I mean, what
Correct.
are the type of conditions that you find it, quite successful?
Well, basically for those kind of conditions, in the joints would be fine, and then we would give some intravenously at the same time. But
Oh, the
some things,
SVF. Mm-hmm.
SVF. Well, this is
SVF.
SVF. SVF is a mixture of things. This is going to be more mesenchymal, but there'll be a little SVF in it, so to speak. But
I see.
realize that when you have immune modulators, one of the main things that MSCs do is they really quell that inflammatory response. Like I say, I liken them to Navy SEALs. They get put into a very tough area. They have a tough job to do. They're outnumbered, but typically because they're so efficient at what they do, they can get that area secure to let the rest of the forces go in and do the work. And that's what they're like. They're basically, going in a hostile area. They're trying to get that area secured so the forces can do their work.
That's so interesting. And those are the cells that also release the multiple growth factors that basically start all that regenerative reparative cascade in addition.
That's correct.
Because some people, say that, when you inject intravenously, it ends up in your lungs, so not necessarily maybe where it needs to be. But what would you say to that?
Well, I would say that I think there's two schools of thought, and I'm kind of like the Switzerland. I think most of them do get, and I'm the Switzerland because I'm using bone marrow and fat also. You have some schools, oh, you got to use fat, some bone marrow. No, you got to use both. But anyway, most of the cells probably are not surviving long, but that's how they work. We have a process for those in the lay public called apoptosis, where the cells are basically killed. But that triggers another a bunch of things. We get something called a T regulatory cell. Now, that's a cell that can last for years. And one of its main jobs is to reduce inflammation and actually help regenerate tissue. So, what happens is these cells may get phagocytized. In other words, certain cells may get them, something called monocytes and things like that.
Eat
And
them
they'll
up.
become,
Yeah.
eat them up, but they'll become T regulatory cells, which are really what I want. You know, when I tell patients, look, I'm not going to cure your osteoarthritis with stem cells. That anybody that's saying that is giving you, selling you a bag of goods. But what I'm trying to do is, on a long-term basis, change the chemistry of the joint so it's no longer inflamed. These are like little biochemical factories that are producing growth factors. The problem you have is the chemistry of the joint. It's when you're having pain, it's because the bad growth factors, and there's basically three of them: IL-1, IL-6, and tumor necrosis factor. Those are the bad guys. They cause inflammation. If I can nullify their effect, you're not going to have pain. I mean, people say, "Oh, yeah, but it's bone on bone." Well, when you do a knee replacement, it's plastic on metal. It's reducing the inflammation that's the key.
I love that because you're going upstream, so you're literally, targeting the main cause of all of it. So not the end result within the chain of command, so to speak. Yeah, that's so interesting. So I know that you also have some unique ways of activating some of those cells, and when you do the tissue expansion as well. So like you're using lasers, you're using specific lights, you're using also sort of other stressors for the cells and activators. So what exactly, I mean, if you, of course, okay to share.
Okay, sure. Listen, I have no real secrets. I mean, even if I tell you, we still keep little parts sort of secret in a way. But anyway, there's a new field out there now. It's called photobiomodulation. What does it mean? Photo means light, bio means biology, modulation. So we're using light to basically modify things. For instance, red light, which has a wavelength around 660 nanometers. What does that do? Why is it so important that I use red light, red lasers, and things like that? Well, what that light does is it stimulates a portion of what we call the electron transport chain, something called cytochrome C oxidase, which is an enzyme that by and large it helps us produce more energy, more ATP. So if I can make my cells produce more ATP, they have a better chance of surviving. It's just like if you send someone out in the desert or something, and one person you give them a pint of water, and the other person you give them a couple of gallons. Who's going to probably survive more? The one that has the extra water.
Wow, that's interesting. Water equals life. That's
Right.
interesting. Yeah. So I also know that you have been using a lot of ozone treatments as a
Correct.
conjunction to, very chronic inflammatory disorders that a lot of those people have, and arthritic joint is just a part of it, of course. And you're also treating the whole person rather than just one joint at a time. So which is why I feel like you're such a unique orthopedic surgeon. So out there. Yeah, tell us more about the ozone, and you use different types of ozone.
Well, ozone, once in a while I'll put an ozone gas. Ozone is basically triple oxygen. It's O2 with an extra oxygen molecule to it. But once in a while I'll put that in the joint. But more importantly, what we're doing a lot of is something called EBO2. What does that mean? Extracorporeal blood oxygenation and ozonation. In a nutshell, we basically have one IV line that leaves the patient. The blood is pulled by a pump. It then goes into a dialysis filter where it mixes with ozone gas. Now, when the ozone mixes with the plasma and the cells and things like that, it gets converted to a few other things. Then the blood leaves that filter and it goes into a machine called a hemolumin machine where it subjects the blood to red, blue, amber, green, ultraviolet A, and ultraviolet C. Then it goes back into the patient. Now, what are some of the benefits that we're getting here? Well, remember, we're talking about pathways. We're stimulating one of the most important pathways in the body to reduce inflammation, something called the NRF2 pathway. I consider it a thermostat of anti-inflammation. If I stimulate that pathway, I'm going to make inflammation go way down. So
Wow.
that's one of the very beneficial things of that treatment. Secondly, what else can that treatment do? Well, we must realize that we're all, as we develop as children, we get these certain viruses, CMV virus, things like that. And as we start to age, these viruses, little by little, start becoming active again, and they start causing inflammation in our bodies. And, I just put
Yeah.
an article on LinkedIn, I think a week or two ago, and I'm having it on my website. They did some studies and they looked at 500,000 patients, and they found that people that had viruses, significant viral infections, had a much higher incidence of neurodegenerative diseases like Alzheimer's, etc. So why else do I like the EBO2? Because that ozone can attack viruses and molds. It can basically kind of destroy their lipid envelope, leaving their DNA and RNA exposed and pretty much kill them. And if we don't get them with the ozone, we get them usually with the ultraviolet C light in our hemolumin. So there's a lot of good things there. It helps with anti-aging, but we do it for a lot of autoimmune conditions because, again, we're reducing inflammation. We do it for people who have Lyme's and mold and things like that. So it kind of makes a lot of good things. It prepares let's say it prepares the garden to have the soil, the seeds, and the fertilizer.
Oh, that is really interesting. So, of course, we know ozone is one of the disinfectants, right? So, and basically it kills the germs, as you said, inside of our own
But no
blood.
ozone ever enters the body, by the way, because by the time it mixes with your blood, it gets converted to something else. Because ozone's fairly toxic. If you breathe it in,
Right.
it's a toxic compound.
Oh, okay. So now I understand. So it's a relatively safe treatment because it converts
Very safe
outside of
because,
the body.
right,
Mm-hmm.
what happens is here's what's really happening. You have something called a hermetic effect. What that means in English is even though something is maybe toxic, if it's given in a very low dose, it can have very beneficial effects on the body. So, in other words, it's creating some oxidative stress, but just enough to get this NRF2 pathway activated. Now, if you had too much oxidative stress, you get something called an NF kappa beta pathway. Again, I'm emphasizing the pathways. That's a pathway that we would see a lot of problems. Remember when people had a COVID storm, so to speak? It was
Mm-hmm.
because that pathway,
Cytokine.
among other things, was activated and causing all sorts of inflammatory responses in the body. Sometimes you need to have that activated to get rid of certain, bacteria, et cetera. But when it's too activated, it can be deadly.
That's right. That's right. Wow. Well, we're going to take a really quick break and we will be
Okay?
right back.
This podcast represents the personal views and opinions of the host and the guests and does not constitute medical advice. The statements contained in this podcast have not been evaluated by the FDA. Any products or treatments mentioned are not intended to diagnose, treat, or prevent any disease. And now your host, Dr. Irina.
Wow, this is really impressive. You know biochemistry that not that many orthopedic surgeons really can say they do. So
Well, you know what they say about orthopedic surgeons? We're as strong as a horse and twice as smart. What can I say?
That's so funny. So you also have mentioned Switzerland, and I know that you also have a very unique, I call it biohacking type of approach and treatment using the intermittent hypoxia. And if you could tell us more about that.
Sure. So when you hear intermittent hypoxia and you say that's really good for your health, people look at you like they say, like I remember I gave a talk last December at A4M, and people are going to say, "What's he been smoking?" No, basically, intermittent hypoxia is very good. Now, what happens is people think of intermittent hypoxia for like sleep apnea, things like that. Very bad. But now it goes back to what I just mentioned previously, the hormetic effect. If we can have a certain stress that doesn't exceed a certain amount, it can be very beneficial. So an analogy I can give you with intermittent hypoxia therapy now, not just intermittent hypoxia therapy, is think of an athlete who goes to Denver, Colorado to train. Why does he do that? Because it's at a higher altitude. He can basically become more efficient in his exercise. Now, what are some of the things that we have done with this intermittent hypoxia? Well, it makes a compound called erythropoietin. Now, erythropoietin, basically, in basic terms, it helps you build more blood cells and things like that. It's a legal way of doing blood doping.
Right.
Unfortunately, Lance Armstrong, I believe,
Exactly. Yes,
got into trouble because he was giving himself injections of this compound.
that's
But
right.
if a patient is just basically breathing in lower and higher levels of oxygen, that's just the body responding to that. So
We,
that's one of the ways that intermittent hypoxia works. It's something called hypoxia inducible factors. Again, it's pathways that are stimulated in the body. Now, a very interesting thing that happens is this also can help reduce inflammation.
oh, that's
And
interesting.
more importantly, it seems to help reduce the mitochondrial damage because mitochondria, remember now, mitochondria are intimately involved with oxygen. And if we start giving lower levels of oxygen, we sort of all of a sudden we stimulate the mitochondria to become more efficient. Now, another very interesting aspect of this treatment, and it kind of comes from some of the treatments or some of the studies we had in Israel with hyperbaric oxygen.
Right.
The Israelis really had a very interesting study a few years ago that they released, and it's really an earth shattering study. What they did is they basically put people in hyperbaric chambers, but they gave them something called an air brake. In other words, they had them, the chamber itself was just room air, 21% oxygen that was compressed. And then they'd have them breathe pure oxygen through a mask. But every 15 minutes or so, they had them take the mask off for 5 minutes. It's called an air brake. And they
Hmm.
just breathed regular room air, even though it was compressed. Now, what they discovered is that it made the cells, the telomeres of the cells of the immune system grow longer in length. They reverse the age of the immune system. Again, immunosenescence. Intermittent hypoxia does the same thing. It tricks the body to think that there's all sorts of, changes going on in the oxygen concentration. So we kind of almost go into survival mode.
Right.
Now, another interesting thing that I mentioned in my lecture last year, there are a certain type of whale in the ocean called a bowhead whale. And there are bowhead whales in the ocean that are alive today that were alive before the Declaration of Independence in the United States was signed.
That's right.
Why? Two things that they do. Intermittent hypoxia, they would take a breath and then go down and they would hold it.
Uh,
And secondly, they're in an area where there's really not that much food. So they would do intermittent
intermittent
fasting.
fasting.
And what do those two things do? Improve the health of the mitochondria, improve their immune systems, et cetera, et cetera. So there you have a very good example from Mother Nature as to how this stuff really works.
Wow, that is fascinating. Yeah, there is also this Greenland shark that apparently lives 500 years, and it's really
Right.
interesting what you just said, that there is a
Well,
potentially a
interesting enough,
mechanism.
when we develop inside our moms, our PO2 is pretty low. And the PO2 that stem cells hang out in, it's in the 80s. A lot of things don't like high oxygen. They don't like the 21% oxygen that we have. And
That
and
is
the
so
intermittent
interesting.
hypoxia is a simple thing. I just have my patients sit in a chair, they're breathing a mask, and then we can vary the oxygen content so we can go up to 23,000 feet, or we can go down to make it 40% oxygen, which is double what you'd have at room air. But it's
That
not
is
under
really
pressure. It's
interesting.
just regular air
Right.
that you're breathing.
Right. Well, being from Europe, of course, so we actually not, and I was in sports medicine, obviously, so it was a common practice for the sports teams actually go to the high elevation, do the training a couple of weeks prior, and then basically fly straight to the competition. And of course, they would perform so much better. So that has been practiced for decades in Europe.
Oh,
So
absolutely. I mean, if you remember many years ago, well, you may not remember, but I remember, you used to have East Germany. I mean, it was a small little country, and yet it would dominate the Olympics because they really looked at the science of sports medicine, as did Russia. We started to do it little by little, and now I think we're all doing it. I mean, it's important, but we can use that science from sports medicine to make everybody healthier. It's not just the athlete.
Right, right. Wow, this is fascinating. Well, and talking about anti-aging, so I do know that you have some of the strategies that you advise people on how to maintain a youthful biological age. So I was wondering if you would be willing to share it with our listeners.
Well, okay, I'm a big believer in intermittent fasting. Okay, so I mean, I think that's crucial for your health. Now, I cheat. I do it for 5 days a week, but I go 18 hours. Um, and then I try and go on the carbs a little low, but I don't go too crazy. I'll eat what I want for that little window of 6 hours or so. Exercise, big believer of exercise. Every morning, I'm out of my house by 5. I walk a vigorous 1 hour walk, about 4 miles. I come back. I do about 25 minutes on my elliptical. Then I go swimming in my cold pool. Even though I live in Florida, it does get cold here. My pool's in the 60s.
Mm-hmm.
And then I get to my office, and that's a 7 day a week thing. I don't go to my office 7 days a week, but exercising is 7 days a week. I take a handful of supplements every day. I do an occasional EBO2, an occasional V cell. I do some intravenous medication, but I don't go crazy. An occasional NAD intravenously and some other things. And I'm really cognizant of following my supplements. Though I take, trimethylglycine to keep my homocysteine levels down. I take very big believer of NAD. I can't stress to you how important that is. I take an NAD precursor every day. I take another interesting supplement a lot of people don't know about called urolithin A. Now,
Yeah, I don't know.
urolithin A basically stimulates mitophagy. Again, I'm getting to my mitochondria. So it kind of mimics intermittent fasting. It's actually kind of a derivative of the pomegranate, but it has to be basically uh, taken care of, so to speak, and processed by gut bacteria. But they do have it as a supplement, and I take that every day without fail. Spermidine, again, that increases autophagy, so I can recycle some of my parts. So some of this stuff is working, I think, for me. I was just going to get involved in a study recently, and I'm still going to probably do it, where I was going to use a suit that basically I would work out, and it has some electrical properties to it, so it would stimulate certain muscle groups. So I did something called clethoprotein.
Hmm.
That's a very important anti-aging protein. So I got my blood level back, and I said, wow, that was pretty good. I was in the 90th percentile. I said, well, that's good, except it was the 90th percentile of the 18 to 35-year-olds. And I'm about twice the age of those guys.
Wow.
So
Oh
I
my
was very
God.
happy about that. What does it mean? I don't know. I mean, I get a little upset when these people say, well, my biological age is such and such. Biological ages are basically a mosaic. You get one test or another test or DNA methylation. Yeah, it's good. There's certainly nothing bad about it, but it's not your true biological age. It's a mosaic, and who knows what the biological age really is.
Yeah, that's very true. And it can actually change. So some people think that the telomere length, so is a kind of set in stone. So it actually fluctuates. There was a study done, of course, by Professor Blackman, who is actually in my neck of the woods at the UCSF, who obviously got the Nobel Prize for the one of the scientists for discovery of the telomere. So, and she actually subsequently did a lot of studies on people who are under significant stress, like young parents, for example. So, and their telomeres go down. So then, the same group or different group, so might be meditators, and their length of the telomere expands significantly. So just after several weeks of particular,
No, there's no question about it. You're right.
yeah, so that is really interesting. So, wow, that was such a pleasure, Dr.
The
Purita.
pleasure's mine.
How can our listeners find you or your clinic? So, and actually both of them. So, would
Well,
you?
they can just look me up, and they can look at my clinic, Pure Form Health. We're in Boca Raton, Florida, which is about an hour north of Miami, kind of between Fort Lauderdale and West Palm Beach. We have about a 12,000 square foot facility there. I mean, you name it, we have it there. I have a nurse practitioner who does a lot of things. I have a PA who does a lot of my aesthetics, and I have a great staff of RNs and things like that. So I have it pretty easy in many ways. I mean, they make my life a lot easier, and it lets me help to innovate and things like that, which is good.
That's great. So, and then if somebody wants to actually consider exploring your Cayman's Island clinic, they would still have to connect you through the Boca Raton.
No,
Uh,
they can actually, they're separate entities, so they can connect one or the other. I mean, they're both online. You just look me up, you'll find them. It's not a hard thing to do.
Okay, perfect. And we'll, of course, list the addresses and the
Well, thank you so much.
yeah, so the contacts. So thank you so much. So you're really, truly an amazing practitioner, and I feel privileged knowing you.
Well,
So
thank you. Again, it's been my honor and my honor talking to your audience, and everyone stay healthy and increase your health span. Thank you.
that's right. Thank you, Joseph. Appreciate it. Yeah. Thank you for joining us at Cures, Remedies, and Beyond, exploring science and the wisdom of health and healing. We hope to see you next time.